Well, thank you, President Aaron. Thank you, Charlie. And just to put a little emphasis on this, you'll hear a lot of the cabinet on this into the public project, but I was going to preview some of the pictures and to say that it's night and day situation where the people were living to where they will now be living. You can't compare it. It's just incomparable. So you'll really not on this program. We'll have more on that next week. So with that, we have birthdays and anniversaries coming up. Kurt is today. Congratulations, happy birthday, Kurt. Who wants to be singing happy birthday?
Happy birthday to you. Happy birthday to you. Happy birthday, dear Kurt. Happy birthday.
What we make up for is, what we like to call it, we make up for is, Harrison Turner has a whole thing coming up on Saturday. And then anniversary, Scott and Kristen Stroud on the 2nd, and Jamie and I on Saturday as well. So, congratulations. Upcoming meetings, we're working on a very exciting program for next week that is not ready to be announced, but you don't want to miss it. And then the week after that, Dr. David English, he is the Chief Academic Officer of the UNC system, the system that controls all the universities in the UNC system, 17 universities and 4 hospitals. So he's going to be very, very interesting to speak. We don't have a meeting on Easter Monday. And then on the 28th, we have Dr. Marion Wolf with the Public School Forum and explain what they do there and the work that they do across the state. And then on the 7th, we have our winner of the Wilson Hayden Vocational Service Leadership Award. And that's going to be a very exciting program. Tom Holder and Mark Hackett have been working on that for quite a while, but a number of other people participating. But the program, the whole program will be that we will make the presentation to our recipients and they will give it have a chance to speak. We'll have a little bit more about that in just a moment. At the end, by the way, absolutely. Today, yes, sir. So we have Jose Salado, who will talk about AI, if we've been asked about AI, and then Dr. Kristen Phelps on the impact of AI. And so, as Kurt just mentioned, we have selected our Vocational Service Leadership Award winner this year, and that winner will be Ira David Wood III. So, Hollywood actor, he's a playwright, he's a director, he's a character. He was really instrumental in the theater in the park and making that successful. He raised funds for lots of different groups. He was really good buddies with Andy Griffith. I guess a million stories about his Andy's with Andy Griffith. And so he's going to be a great recipient because of what he does in the community, not just his performance, but what he's contributing to the community. And so thanks to Kurt Warner, who was the sponsor for this award. So we thank Kurt for that. And Kurt will be giving a full introduction when the time comes. And that will be coming up very, very soon. So with that, we have our program, and we have a little event before the program. So Mary and Bill and Tom Holder could come up.
Would you do the QR code? Yeah. Okay, you don't have to pay all the videos on.
And our program today is the Great Smile, which acts at that performs the work they do at the River Club of Raleigh Dental Clinic. So Sommer is the CEO. I'll introduce her in a moment, but we want to do a little ceremony first. Sommer, if you would come up, and we have Mary and Bill present the ceremonial check, and then Tom will have the real check for you. You can take your bank. And we selected Bill and Mary because Bill really introduced us to Wake Smiles at the very beginning. He's instrumental in getting our involvement in that program. And then Mary Moss was just a major fundraiser for our big project there. She's never said this to me, but I have a real sense she lost a lot of business because of the time she spent on Wake Smiles and our project. So she's been very gracious. So there's lots of people that will be out here, but these two keep in mind. So if you would, with our congratulations. Okay. And then, Sommer. We have a banker who has something that is probably more spendable than a bank. It's getting his head to it. It's not big, it's good. It's not small. You got sometimes when I get a vibe introduction and I have to do work, I can change the word or something. It's just so well, it's so summer. It's really good. So summer wishes is a proud target of graduating with your BS in dental hygiene from UNC School of Dentistry. Prior to being in the dental profession, Sommer worked for 12 years in the nonprofit sector, both locally and globally. Her career in private practice and now as Chief Executive Officer of Wake Smiles, a free non-profit dental clinic, is a perfect combination to keep her passion for dentistry and access to healthcare. He does a lot. Sommer is also a member of the UNC Dental Hygiene Community Advisory Committee, serves as an adjunct clinical professor at UNC, and is on the board of the North Carolina Association of Free and Charitable Clinics. When she's not consumed with all things teeth, she loves to spend time with her two sweet children, Finch and Ruby, which are two really cool kid names. I love those names. So, and finally, on a personal note, she has the coolest haircut of anybody I know. So, please welcome Sommer Wisha, CEO.
I think you're good. I'm just, thank you guys for having me today. I do this every year, and it's really neat to see the same faces and new faces every year. Thank you so much for everything so far. I'm going to get my presentation here. I forgot that you would read a bio, so I do have a slide about me, and I'll just quickly go over it.
No.
I've been hearing about the person.
I don't think he put his email.
That makes it more fun. So I've been at Wake Smiles now almost 2019. And before that, I was a practicing dental hygienist in private practice and volunteering at Wake Smiles. I have two amazing children, almost 8, almost 6. So life is very busy. And I am obsessed with all things teeth and access to care. So it's really cool to be at a space that can merge the passion I've had since I was a little girl writing love letters to Mary, with the absolute belief and conviction that I have that everyone deserves the same care, no matter who they are or who they are. So my connection with UNC, going to school there, becoming an adjunct professor and on many committees has been really, really important to me. And actually connects Wake Smiles with Vancouver because of that. And then North Carolina Association of Free and Charitable Clinics, Wake Smiles is part of their clinical system. We're one of 2 standalone dental clinics in the state of North Carolina that are considered free and charitable. And so being a board member and learning from that perspective, I feel like I should wait. Should I wait? Learning from that perspective. Can you hear me if I talk? I'm really loud. So hearing from that perspective about what the association is doing for constituents in our state that lack access to care and health insurance, it makes me even more committed to do one. So that's a little bit about me. Now let's talk about our mission is to improve lives of under-resourced adults through better oral health. We have been doing this for nearly 25 years. In the current space that is Rotary Dental Clinic since 2013-14. We have 3 main programs, all housed within what we do, and even some within those programs. So we have our education, prevention, and restoration program. So education is pretty straightforward. We know that if you can give the right education to someone and they can learn and improve their literacy, that moving forward in life, they take that with them. So we do this with an oral health background, with our patients, but also we get to do this with upcoming dental professionals. So something really exciting in the last week is Wake Smile is a host site for UNC's dental hygiene program, Wake Tech's dental hygiene and assisting programs. We also host third-year residents doing endodontics, so we all love root canals. So they're coming to Wake Smile to learn how to do, well, they know how to do them, but they come and serve our patients. And just as last summer, we started hosting third-year dental students for 4 weeks over the summer for their discipline and service learning rotation. So this has been really cool to show public health to future clinicians. Our goal is that when they have a fancy private practice, that they continue to remember that people are in need, and it's their social duty to give back to those people. Prevention program, we know that dental care, most of our patients, we only serve adults once again. Most of those patients have lacked access to prevention. The key age for that is childhood adolescence. So when our patients come to us, they are mostly in advanced stages of disease. While you can't really reverse the impact of disease, you can stop progression of oral health disease. So we work on doing that with our hygiene program, and we have a systemic oral health improvement program that works with people with uncontrolled diabetes and gets them into a path of health and improved diabetes care. Diabetes and oral health, particularly periodontal disease, are directly related. So if you can improve one while improving the other, outcomes for health are much, much better. And then restoration is exactly what it sounds like. Our restoration program really works to improve the dentition and integrity of the mouth. So this is done through fillings, yes, extractions, yes, but also we have dentures that we do on site through digital scanning and endodontics. So we're saving teeth. Last year, or since the inception of the program, we saved 200 teeth. I know that's maybe weird, 200 individual teeth. That's people not losing teeth and being able to keep that tooth and that smile. And it might be what frames their face. And if you lose teeth, it can take away the integrity of the shape of your mouth, dentition, talking, eating. So we're so thankful to be able to save teeth. So those are our 3 programs. Last year was our biggest year. It's really cool to see the progression. I'm sure that those of you that were here when we started or have been here since 2013 and know about Wake Smiles, you see these numbers jump annually. So each year we are seeing more unduplicated patients. So over last year, we saw over 1,000 unduplicated patients. We had over 3,200 patient visits, and on-site alone, we gave out 1.7 million in care and no cost. We're really proud of that, and that's individuals, not just those numbers of people. These stats are a little old, and they haven't released any new stats. And I actually had this on the presentation last year, but I do have some new information, which is going to lead us to what we're starting. So we've done these 3 programs successfully for almost 25 years. And starting this year, we're starting the urgent care. And I'm really excited about it. And we're expanding our space. And that's what I'm here to talk about, because it's a huge deal for Wake Smiles and actually the Salvation Army to allow us the space to do that. So we know that there's a lot of uninsured individuals in North Carolina, in particular Wake County, even though Medicaid expansion happened and a lot of people did gain insurance, a lot didn't. And also oral health dentists, only 45% of our state except medical. So it actually really less than that. So there's still a huge access issue. Cost of dental care is extreme. I don't know if any of you have paid a lot for dental care, but if you're uninsured, it's double or triple the cost of anything medical. So we know that people are not putting their oral health to a level of importance because they can afford it. So on top of that, this stat on the bottom, a few years ago in 2023, we still partner with Wake Med Emergency Department and their Wake Med Center for Community Health. And we try to get those frequent flyers that go to the emergency department for non-traumatic dental pain to come to us instead. And over this, it doesn't say this, but in a month's time, on average, 223 individuals visited the ER for non-traumatic dental pain, just with that. So when you go to the emergency department for, say, pain in your mouth or abscess swelling, to really diagnose that, you have to get a CT head scan, which is about $1,400. And then there's not a lot they can do other than prescribe antibiotics. They might do a drainage procedure, but the thing is, you'll get the antibiotics, you'll feel better, and you won't get the problem solved. You go back in about 2 months for the same issue and the same cost. So that number is striking to me because that's one hospital system in our area. So why should we respond to this? Why are we responding to this? Why is this a project we're even taking on? I'll tell you what we're doing first and I'll go over these. So how many of you have seen our site, been into the clinic? Oh, cool. That's a big number. Please come anytime. I promise I won't pull your teeth. Just come. It's a beautiful site. We have 4 operatories. We have 1 administrative area, but we are truly busting at the seams. We've had it for a while. And so we presented this problem to Salvation Army, who was also busting up the seams. If you've been there, they're doing great. But they're such a beautiful partner. And I said, we really need to expand our clinic. We need at least 2 more operatories or clinical exam rooms. What can we do about it? Their team, my team, and we decided on an answer. And so we're actually going to extend behind our clinic and add 2 more operating rooms, as well as more administrative and clinical patient space, and then an office. I haven't had an office in 4 years. I'm highly distracted every time I'm at work because I'm in the midst of everything. And so I'm very excited to have a space where I can pass the next vision for Great Smiles, along with being in the clinic itself, not in a separate space. So that we're in the middle of getting permitting for that. We have all everything purchased. Really happy to tell you that it's fully funded. So from 2 grants and 1 ask for the private donor, we raised over $400,000. So
That's awesome.
But the answer to get these grants and to have a private donor give $200K for what we do was not difficult because of these reasons. We have a 25-year track record serving the population that we serve. We have over 50 agencies in the department. I see you here, Neighbor Health. We are so proud to partner with agencies that are seeing the same patients. We're proud to partner with Med Community Hospital, with the shelters in our area that are serving unhomed. We just started a new partnership with Kings Ridge, which I don't know if y'all have heard about Kings Ridge. If not, that's a great speaker to have here. Aaron Yates is their ED. So they are housing over 100 unhoused families. And by just doing that, and these apartments that are very nice and all furnished, just by doing that, they reduce Raleigh's homeless population by 10%. So, and not only are they housing them, but in the building, there's wraparound services. So there's medical, behavioral health, and orthodontic component for this. And that's an exciting partnership that we're able to do because of this extra space. Wake County is growing, and we are still the only clinic doing this in Wake County. We actually are extremely at capacity. Even with the expansion, I don't think we'll be able to serve everyone as quickly as we push through this. Every week, we get about 30 to 40 phone calls with people in pain. And we have a process to go into our clinic. And we have eligibility requirements, and that's important to have, because otherwise we would be bombarded. But to tell someone, yeah, we have some open spots, and they fill up quickly. Here, you can go here, but you're going to pay at least $400 just to get a diagnosis. That's not good treatment. That's not a definitive solution, and people can't afford that. And so our goal at this clinic is, no matter who you are, you can walk in. Within about 2 visits with us, or maybe even 1, we can solve the problem. And hopefully reduce the number of phone calls, reduce the incidence of the ER and have them come straight to us. I don't remember the next slide. What are we doing? So we're doing right now, we just started this on-site dental triage. So we're working at Kings Ridge. We're also working at Alliance Medical Ministries as our pilot program. And we will be going, our public health hygienists will be on site during medical visits, working with individuals assessing oral health increasing them to our clinic if they have urgent dental needs, and then assessing them for, their diabetes health or hypertension health along with their periodontal health. So this is actually really cool. Integrated care is very important for patient outcomes. And there's not a lot of this happening, even though it should. Eyes and mouth are taken away from the body with insurance companies. So often they're overlooked in the medical world. So we're trying to merge those, and we're thankful for those pilot projects. And hopefully reducing the amount of time from the first visit of their primary care provider to us. We are also partnering more with community organizations, places like Places at the Table, I'm sure you all know that. Partnering with the hospitality workforce, just different ways to get people understanding what we do, and then into care quicker and easier, and without the barriers of transportation or other issues they might have. Obviously, we're doing preventive care, and then after that urgent care need is met, if, for example, the patient comes to us with an urgent need, we can actually on-site get them an appointment at one of the medical clinics to get into care and get full health care and come back to us for comprehensive care. So they're not just getting an emergency and then coming back to the next emergency and the next emergency. Hopefully, we're gonna get their full health and preventive care started. This is a little patient journey scheme that we made up, but it's actually really like what we see all the time. The top line is someone maybe that's unhoused. They have dental pain. They go to the ER. Because they're in pain, they might miss out on work, they might lose their job, they might miss out on sleep, and then what the outcome is actually just costing everyone a lot without a resolution. The bottom scheme is really what we kind of do now, but we'll be able to do more of with the urgent care clinic. And that is, someone might be in a shelter or in a house situation. They have dental pain, they can come to our clinic. We do an examination, look in their mouth to help, and the win here is they're healthier, they save the county lots of money, and we have a healthier community, which we desire in this beautiful city that we live in. Expected outcomes are reduction of the ER usage for non-traumatic dental pain, reducing that number of over 200 individuals going monthly. Obviously, the cost last year in 2024, we alone diverted over 5.8 million ER costs just by its science, which is crazy to me that much money was saved in cost. Increasing the number of individuals at primary care sites. We hope that this clinic will allow us to see about 365 more individuals a year, which means some of them will absolutely be uninsured, and they will be able to go to our partnering clinics for full health care. And we know that if their mouth is not healthy, likely their systemic health isn't great either, and we become more stable all around. And then obviously ripple effects on Wake County, and if we can master this program, I think that it's really it's easy to replicate in other areas and other counties and other clinics. You don't need a lot. There's a lot of rules and a lot of money that dental does need, but you don't need a lot of space to do this. You just need a lot of good hearts to do this, and obviously licensed professionals. The next slide. So our theme of our campaign that's launching in a few weeks is more chairs, more care. Like I said, we already have everything funded, but there is an opportunity to give to sponsor patients, to sponsor equipment, to make sure that you have a mark on this next extension of Wake Smiles. We obviously know that you guys were a huge part of us being in Salvation Army. I don't think we would be there without y'all. So I'm honored as the CEO to be in that space because of Rotary, and I'm even more honored to invite you to go on this next regular journey and help more individuals that need care, and hopefully remove another barrier to being healthy, because we all deserve to be healthy in our lives. And I think a lot of times we take it for granted. So there's a QR code. You just take out your camera and you take it. Well, the QR code will come up, the web link will come up to donate if you wish to do so. And then after this slide is my information and our website. If you want to go back to the other slide, That's good. You guys can also reach out to Lynn at any time for my information. I want to personally invite you to come see Wake Smiles. We're lucky to have a lobbyist working with, the state budget, which is fun, to get some funding in. And I'm seeing legislators almost every day, and it's really cool to invite them into what we do, for them to see how important what we do is for our county. And so y'all are invited. Please come and see our clinic. It's really fun, it's beautiful, and you probably have not seen a dental office like this. So, thank you for your time. I'm ready for questions. I know we have a few minutes, right?
We had a very short business meeting this morning, so there's plenty of time for questions. You won't be able to people up. So please, Sommer is here, to answer questions. So let's go.
All right, so Summer, what is the source of your operating funding? I remember I was involved early on, but it's more, I'm sure it's changed over time. So how much are you getting, like funding support from grants or county support or private, that?
So what our revenue sources are basically. For our budget right now is 1.3 million. When I started, it was 160,000. That was 8 years ago. So we changed a lot. But mostly grants that we received from foundations, private donors. And 50% of our budget comes from patient fees. They are asked to pay a $40 fee. If they can't, it doesn't matter. It costs us $150. And then that's it. Like Wake County, we get 52,000 from Wake County for our dental position.
So that's all the government funding you get right now.
Yeah. Brandy is our treasurer. Hello.
So when it was initially formed, it seemed like it was more folks in the oral industry, dentists and, oral surgeons, orthodontists and everything, but you're expanding and bringing in more folks that are more laymen to your board, and thank you for having me.
Yeah, when I started Wake Smiles, I remember during the meeting, I was like, why is the board looking at this is a problem? And we have diversified our board, and I'm thankful we have different people that bring different things to the table, which I think if you're in a nonprofit world, you need a scope of who you serve and people in the community. So Brandy is one of, well, now only half, a little bit over half have to be dentists to be on our board. So if you're interested in learning about Wake Smiles in that way, we are recruiting for members next year. Yeah, very much.
Yes, I missed it. It said, what's the total cost of the renovation?
Total cost of the renovation is, I should have that number down. I think it's right at 405. Yeah, and we raised 400. I know, listen, I don't know how it happened, other than,
It's just great.
yeah,
This is a real success.
it is a success story. We talked about a capital campaign, we've done many of them. And I was very terrified because I've never done one, and it is not. And it's just a pace, yeah, I'm really thankful.
Is there a criteria patients have to meet, in other words, they have to be below a certain limit, something like that?
Yes, our patients have to be an adult, they have to live in Wake County, they have to be uninsured, and then be 250% of the federal poverty level. So that's that each year. By the yes.
What percent of the professional community is participating by delivering their services as dental professionals?
Like volunteer?
Yeah.
Thank you for asking. So we have a hybrid model now. When I started, it was thoroughly volunteers. I would say the percentage is very low when we look how many dentists. There's over 6,000 hygienists in North Carolina. As a state, over 3,000 dentists in North Carolina. But we have over 100 that volunteer each year. They might come once for 4 hours, they might come weekly. I am really proud to say that we have like 3 dentists that come every single month, every single week, which is really cool because they can. Hygienists, we have a few that come annually, like maybe every quarter. And then the other cool part, the dentists that don't come to our practice, we are partnered with, I think, 14 private practices that see our patients there at no cost. So these are for like specialty care. Maybe an oral surgeon will see them for mouth extractions. Maybe a prosthodontist will give them a full, beautiful, gorgeous denture at no cost. So we have those partners in our community too. In fact, last year, that service, seeing patients in their office, they gave over $160,000 to care at their cost. Actually, can you go back to, there's a slide with a picture. This is a really cool story. This is one of our patients. He came to us from Raleigh Rescue Mission, which now Raleigh Rescue Mission is a work to house program. So you have to be working to get to housing. That's their model. So he was working really hard. He came in, he was so joyful that he did this all the time. He did, I had no idea what he was about. He was very much in pain, full of shame. He needed, when he was assessed by our dentist, he needed mouth extractions. There was no fixing anything. And so our team did those, but then he needed a specialty surgery, which I won't tell you about because I think it's cool, but it's pretty gross. And he had to do that with one of our oral surgeons who saw him at no cost. That's a very expensive surgery. And then our prosthodontist, Dr. Bragg, in North Carolina implant and prosthodontic surgery, saw him for his case. And one day I was sitting in my office and I see a picture come through from Dr. Bragg. He's like, we've all been trying. There's like a tear from everyone's faces. He's delivering. And I showed my team like, oh my gosh, you got a center. 20 minutes later, he came to our office to show us. And he never stopped crying. And he and Alex, our operations director on the left, they were in the lobby looking for 5 solid minutes. I thought it was Alex's long lost brother or something. That was our patient. And his whole life changed through the work he'd been doing with Raleigh Rescue Mission, also because of all those things. And he got his mentor and he felt like a new person. You could see it. He looked like 10 years younger too. So his joy that he had in his eyes is now like not ashamed to show. It was really cool moment.
I was gonna follow, so you talked about prevention, my daughter-in-law works at a pediatric dental office, and it's sad, the cases of kids that come in because their parents just don't understand what they need to do for their teeth. So how are the dental community, if you guys are involved, reaching new parents that may not have a good understanding of bad things to do with your kids, like letting them go to sleep with a bottle, there's a lot of things that they're doing to ruin their teeth at an early age.
I mean, also cultural too. I think there's so much of a lack of oral health literacy. You do an oral health literacy assessment, pre and post care, and it's wild to see how much they learn as an adult that they think about. A lot of our population are not maybe from this area or from this country even. So those standards are different as well. Diet is different. So there's a lot of factors that go into what you're saying. I believe if we can teach parents how to care for themselves, and we're talking about food intake and how they care for their mouths, that will trickle to their children, for sure. One day a year we do Big Kids a Smile, and we see like 60 kids in 4 hours a year. And we get to do that, and people see rampant decay towards mouths, and it's just lack of education. So it's our opportunity to do that. In school, I thought I'd always be pediatric. I thought I'd be nice. I'm really glad I'm not.
Oh.
But we do have an option, or I guess an opportunity to teach parents. Most of our patients have children, so that's our way of doing this. For sure, we need to do that. Yes.
I see up,
Oh, sorry.
I see up there you have 1,000 patients, 3,000 visits. Is that translated to the average patient comes with 3 times a year?
Average patient, they actually graduate our program. They don't keep coming because there's a constant wait list. The average patient needs about 10 visits to get to help. Most of our patients need something that's called a skin replanning or periodontal therapy, non-surgical periodontal therapy, which means we have to come them out, can't numb them out in time, restore it. We do face treatment, so we start in the quadrant and move around the mouth. So it takes time. Yeah. And you had a question?
No, I'm
Oh. I will share quickly a story. I had a friend who's a dentist that texted me and said, hey, this patient said I could say this. I saw Caroline today and she loves you and Rotary loves you. I'm like, who the heck is Caroline? I don't know Caroline or Rotary. So confused. I start thinking about, oh my God, that's Carrie. So it's Carrie, your Carrie, was being seen by this dentist, loves the dentist, and the dentist donated. Wait, it's not okay. based on what Perry said in the chair. And I thought, how cool is that? So, you know, you can go to your dental provider and talk about us, even though we're the only clinic and we are very well connected in the dental community, there's still everything we do. So I invite you all to share that. If you're going to your dentist every 6 months, you should. Feel free to talk about us, why there are instruments are in your mouth. Because that's what they do. They act like, why there are instruments are in your mouth. Share that. Anyway, thank you so much. Anyway, thank you so much for your time.
Thank you, Thomas. You know, I do leadership work, and when you have the right leader in an organization, it's very evident that what the organization is doing. We have the right leader at Wayne Smiles. It's wonderful. So we love the relationship we had from the beginning. We thank you for the update. We do have for you a Rotary Club of Raleigh mug. And if you drink too much coffee and yet stay, I bet you know we can get cleaning. Okay. All right, thank you so much. All right, let's stand. And I wanted to say again, thank you to all our visitors. Bob Hunter was like that to leave, but that's great. The voice of the page, you're always welcome there. And all of those, thank you for joining us. And for the rest of us, we'll do the 4-way test in the things we think, say, and do.